Today, we really wanted to talk about the complexity of treatment in really complicated cases. So, Jean, I hope you're ready for this morning.
We're talking about complexity. Yeah, my brain.
There are some conditions in health that are really simple and straightforward to treat. You get a strep infection in your throat. We know antibiotics will work, or anything that's going to kill that bacteria will work. So certain things in healthcare are really simple. But when we come to look at chronic and complex health conditions, things can be a lot more tricky than just a simple
take this and it goes away.
Yeah, exactly. One cause of the illness and a simple cure. And I think it's really important to talk about complexity because of that, because often people will say, I have raised insulin, or I have this or that. How do we fix it? How do we treat it? And of course, there are general guiding principles. But one thing that I think is really important is to understand when it comes to very chronic and complex diseases, things aren't always just as straightforward as, one cause and one cure. So
I think it's also a really good, it's a good explanation as to why we see people multiple times. A lot of people will come to us and say, can you fix this? And why do you need to see me again? There's this expectation, because that's how mainstream medicine does it pretty much, that, you see the doctor and then they presume it goes away, and, you don't see the doctor again until you're ill again. Whereas we see patients on a very regular basis, monitoring.
In the case of chronic complex disease,
yes,
there are, of course, things where it's a simple one cause, one treatment. Yeah. That's a good point. So we actually was speaking earlier on, and we spoke about getting people to understand the difference between complicated system and complexity. So complicated and complexity, when we use those terms. So if you think about an airplane like a Boeing, the engineering in there is incredibly complicated, very sophisticated. But every single variable is predicted. So if you change one variable, you know exactly what's going to change and how, predict exactly what's going to happen.
Thankfully.
Yeah, exactly. When you're up in the air,
30,000 feet up, you want that.
Grateful for that. However, the human body has complexity, and that's because we are all made up of unique genetics. So we have, there's over 80 million unique variables that come into play with our genetics, because, we all have very, very unique genetics. And so that means we're not looking at complicated, we're looking at complexity. That means with every variable you change, a number of things can happen. Now, we have principles in natural medicine, so we kind of know that this is likely to do this and likely to do that. But there's always this factor of complexity that comes into play, that we don't always know exactly how the body's going to behave.
Exactly.
Yeah. So that's the first principle. And then the second principle, when it comes to treating complex conditions, it's kind of like a chess game. Rather than playing checkers, it's a chess game. In other words, you make a move, you wait and see what the body does, how it responds. And then based on that, you strategically make your next move.
Yeah.
And then you wait and you see how the body responds, and you strategically make your next move. And hopefully you move towards that kind of winning the game in the end. But it does mean that it's a constant game of making some kind of changes,
and waiting,
watching how the body responds, adapting to that, and altering. And I think that's also why we do believe in following up and testing. It's not just running a test once and finding things and going, oh, that's how things are. That's how things are at that moment. But obviously watching how things develop over time is really important.
Yeah, and I mean, a blood test is literally a moment in time at that point. Now, there are some of those variables that will be static for weeks, and some of those variables that will only be static for the next 3 hours, the next 4 hours, and will change and adapt. That's because of the complexity of the human body. And yes, it's that waiting, it's that making the move and then waiting and watching and then making the next move. And that's why we work with, that's how, it's a great explanation of what we do in herbal medicine as well, and why the herbal side of things is really helpful in the cognition side, because there are certain things we will work with patients that we know, for example, something like vitamin D. If their vitamin D is low, we know they need to be on vitamin D for 3 months, 4 months, 5 months, till we get those levels back up. But then when we change things, when we are actually working with this incredibly complex system, it's why we meet monthly and we see how someone is reacting, how someone is improving. And the herbal medicines are the element that are constantly moving and dynamic. So at each consultation, the medicine will change. So, and we will look at the person it's the same in my practice all the time anyway, as we meet monthly, we will review how this person is, and the medicine will change depending on what that person is then presenting with. And it's that's what makes what we do work. That's what makes it successful, is because it's the epitome of personalized, individualized medicine at every point.
Exactly.
Which is lovely. But yeah, the complexity of the body, people are unpredictable. You can totally expect one thing to happen and something very different to happen. And that's why you have to always be ready to pick that up and move with it.
Wouldn't it be just simpler if we were Boeing engineers, Jean?
Or boy, yeah, if we weren't quite so complex. But that complexity is beautiful.
It is, absolutely. And it's what makes our work really interesting. You know, it's you know, we see this quite often. You'll get some blood results in and you're like, okay, what's going on here? You know, what exactly is going on? We measure a whole lot of stuff, and it's you do look at individual markers, but you really draw all of that together into a pattern, right? And to look at lots of different things to try and understand exactly you know, what the body's doing. I think, you know, just as an example, ferritin is a really good one, which we, you know, often measure, and the NHS and GPs will measure as a marker of your iron status, you know, how much iron there is. But sometimes you can look at a ferritin that's quite high, and the person is still iron deficient, and that's because ferritin can also be a marker of inflammation. So, you know, when you look at these labs, you have to look at them in the context of what's going on for that person. And, you know, you can't just make black and white assumptions on things. You have to really know what's happening in that person's body, and to get an idea of how to interpret the results.
Absolutely. It's really interesting. It reminds me of why, you know, as a herbalist, we never ever say, well, that can't happen with that herb, because that herbal medicine is used by that person's body, and that person will react in a completely individual way to that one medicine. So we have certain herbal medicines that in 90% of the population, it will do one thing, and in 10% it will do the opposite.
Yeah, it's interesting. I think valerian is one of those that you've mentioned in the
and passiflora is another one.
Yeah.
There's a very specific type of person that does not do well with passiflora and valerian, and it's the beauty of it's the thing whereby I frequently hear someone will come in and they'll say, well, I've tried herbal medicine, it didn't work. And you think, but you know, it's not a drug. It's not the same as a medicine that you take a paracetamol, it takes your pain away. Herbal medicine is very interactive and will interact with the person in an individualized way. And that's why some people will use black cohosh for menopause and it does nothing. And for other people, it transforms their life. And it's because that was the right herb for that person.
Yeah, acupuncture is, sorry.
Yeah,
acupuncture is very much the same as well. People will come in and say, well, I've tried acupuncture, it didn't work. But it's because it's knowing what's right for the person at that specific moment. Yeah.
Yeah, no, fascinating. The human body, it's wonderful.
Well, hope you enjoy the rest of your day.
You too. See you soon.